Making an incision is the first part of every surgery. And so it's important that the surgeon is able to perform it with confidence and impeccable technique. In the video on scalpels, we've discussed the different types of scalpel, when we would use them, and how we should handle them safely and with fine control. In this tutorial, we're going to demonstrate how to apply what we've learned previously to help us make a safe and accurate incision. Before making an incision, we need to plan the direction, shape, and length of the incision that we want to make. It's best that the line of incision is made parallel with the lines of skin tension, also referred to as Langer's lines. Langer's lines can be demonstrated by assessing which way the skin creases, as the creases formed will indicate the lines of tension. In some cases, it may be of benefit to draw the incision out first prior to making it, so as to help guide us. As we mentioned in our video on scalpels, we can hold the instrument either in an overhand or a pencil grip. Whichever grip we use, it's important that when we make the incision, we use the body of the scalpel blade to cut the skin, rather than just the tip. As the body of the scalpel is the sharpest area of the blade, this allows us to make a smooth and uniform incision. Additionally, it's important the blade be kept perpendicular, so at right angles to the skin. This prevents any angulated incisions deeper to the surface of the skin, which may result in unequal skin surfaces or shelving of the skin edges. It's important to avoid these things, as if they occur, they may lead to poor wound healing or cosmesis. When making an incision, we should use the other hand to help stretch the skin. By making the skin tighter, this makes it easier to cut and allows the incision to be made in a more fluid motion. However, it's important that we cut away from our hands and never towards them, due to the risk of unintentional injury. With inexperience, we may be slightly nervous when we make our initial incision, and this may lead to us being too delicate and making multiple small incisions. However, this should be avoided, as by making multiple delicate incisions, we end up with a ragged and unpleasant looking incision. Therefore, it's better to carefully plan our incision, and then confidently make one smooth and accurate incision. When undertaking laparoscopic surgery, we need to make small incisions via which we insert the laparoscopic ports. We make these by performing stab incisions, using either an 11 blade or a 15 blade.